In the maze of bureaucratic paperwork and medical examinations that veterans must navigate, securing the correct disability rating can sometimes feel like winning a hard-fought battle. Understanding the Disability Benefits Questionnaire, or DBQ, for low back pain is your primary tool for communicating the extent of your disability to the Department of Veterans Affairs, also known as the VA. This standardized form aims to streamline the collection of necessary medical information, allowing for quicker decision-making on your claims. A thorough grasp of this form is vital. It captures your diagnostic and treatment history, details on pain severity, range of motion, and the effects of your condition on daily living. A detailed DBQ not only aids the VA raters in understanding your physical limitations, but also equips your healthcare providers with the framework to conclusively articulate the medical basis of your condition. It is of paramount importance to ensure that all sections are meticulously completed. Missing or inaccurate information can lead to an underestimation of your disability rating, adversely affecting your benefits. The degree of detail required in a DBQ means consultations with your healthcare provider should be thorough. Discuss every symptom, no matter how minor it may seem, and make sure these discussions are reflected in the questionnaire. Remember, in the context of VA claims, more information typically leads to a more favorable outcome. Effective documentation and testing during C&P exams. Central to the VA claims process is the C&P exam, a crucial event where a VA healthcare provider assesses your condition to verify and evaluate the disability. Before attending the exam, gather all relevant medical records, previous test results, and a list of symptoms linked to your low back pain. This preparation can significantly influence the outcome of your claim. During the exam, clear communication of your pain and its impact on your lifestyle is crucial. Testing may include physical maneuvers to assess the range of motion and might also involve imaging tests like X-rays or MRIs, depending on the complexity of your case. To avoid discrepancies and to ensure the accuracy of these tests, insist on the utilization of proper testing protocols. Moreover, after the exam, review the physician's documentation to ensure no critical information has been omitted. Identifying errors or omissions early on gives you the chance to request corrections before your claim is processed. Remember, the effectiveness of your documentation here can determine the speed and success of your claim's approval.
When dealing with the VA, a well-documented medical history that succinctly outlines the progression and management of your low back pain is invaluable. It serves as a critical narrative that contextualizes your current health status and justifies your claim for disability benefits. Begin by collecting documentation right from the onset of your symptoms, including your initial visits to medical practitioners during and after your service. Highlight treatments that you have undergone, noting any periods of exacerbation or stabilization. Including a chronological breakdown of treatments and responses helps in building a strong case for the severity and persistence of your condition. Your medical history should not only reflect the physical aspects of your condition, but also mention any psychological factors. Stress, depression, and other mental health issues often accompany chronic physical ailments and can compound the effects of physical disabilities. Low back pain rarely exists in isolation. It often leads to secondary conditions such as depression, sleep disturbances, or even more severe mobility impairments. These secondary conditions can significantly impact your overall disability rating, making them critical components of your claim. A profound understanding of how secondary conditions relate to and exacerbate your primary disability is necessary. Ensure that these conditions are documented thoroughly in your medical records and DBQ. Articulating this interconnectedness to the VA can often lead to a higher disability rating, as they take into account the broader impact of your primary condition on your overall health. Highlighting the cumulative effect of your low back pain and its secondary conditions in your claim compels a more comprehensive evaluation by the VA, which can lead to a more accurate representation of your disability in terms of compensation. Understanding these intricacies and leveraging them in your documentation are pivotal in navigating the VA's claim process efficiently.